Arthritis is a general term used to describe a group of more than 100 different types of joint disorders that involve inflammation of one or more joints. It is a condition that primarily affects the musculoskeletal system, causing pain, stiffness, swelling, and a decreased range of motion in the affected joints. Osteoarthritis is the most common form of arthritis and is often referred to as wear and tear arthritis. It occurs when the protective cartilage that cushions the ends of bones in a joint gradually wears down over time. As a result, bones may rub against each other, causing pain, stiffness, and reduced joint flexibility. Osteoarthritis commonly affects weight-bearing joints such as the knees, hips, and spine. Rheumatoid arthritis is an autoimmune disorder in which the immune system mistakenly attacks the synovium, the lining of the membranes that surround the joints. This chronic inflammation can lead to joint damage, deformities, and other systemic complications. Unlike osteoarthritis, rheumatoid arthritis can affect multiple joints simultaneously and is not solely a result of aging or joint wear. Other forms of arthritis include gout, lupus, psoriatic arthritis, ankylosing spondylitis, and juvenile idiopathic arthritis, among many others. Each type of arthritis has its unique characteristics, causes, and treatment approaches. Just a quick reminder, the content provided in this video is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. While medication and lifestyle changes play a crucial role in managing arthritis, dietary choices also play a role in either alleviating or exacerbating symptoms. In this video, we explore foods that individuals with arthritis may want to limit or avoid to promote joint health and reduce inflammation. Number 1. Refined carbohydrates. Refined carbohydrates, such as those found in white bread, white rice, sugary cereals, and other processed grain products, may potentially contribute to inflammation and worsen arthritis symptoms for some individuals. Refined carbohydrates have a high glycemic index, meaning they cause a rapid spike in blood sugar levels. This spike is followed by a subsequent drop in blood sugar, which can lead to increased inflammation and may negatively affect arthritis symptoms. Consuming a diet high in refined carbs may contribute to chronic low-grade inflammation in the body. Inflammation is a key factor in many types of arthritis, and a diet that promotes inflammation may exacerbate symptoms. Refined carbs often lack essential nutrients that are present in whole grains, such as fiber, vitamins, and minerals. A diet deficient in these nutrients may compromise overall health and potentially impact the body's ability to manage inflammation. Number 2. Gluten. The relationship between gluten and arthritis is complex, and it can vary among individuals. Gluten is a protein found in wheat, barley, rye, and their derivatives. Some people may experience sensitivity to gluten, while others may have celiac disease, an autoimmune condition in which the ingestion of gluten leads to damage in the small intestine. Joint pain is one of the symptoms that some people with celiac disease experience. While arthritis is not a direct result of celiac disease, joint pain can be a secondary symptom. Some individuals may experience symptoms similar to those of celiac disease when consuming gluten but do not have the autoimmune response seen in celiac disease. This condition is often referred to as non-celiac gluten sensitivity. Joint pain and inflammation are among the reported symptoms for some individuals with gluten sensitivity. If you find that eating less gluten, or no gluten, eases your inflammatory arthritis symptoms, then it could be a viable option for managing flares. Number 3. Vegetable oils. Many vegetable oils, such as soybean oil, corn oil, and sunflower oil, are high in omega-6 fatty acids. While omega-6 fatty acids are essential for the body, an imbalance between omega-6 and omega-3 fatty acids may contribute to inflammation. Chronic inflammation is associated with various health conditions, including cardiovascular disease and arthritis. Vegetable oils, especially those high in polyunsaturated fats, are susceptible to oxidation when exposed to heat, light, and air during cooking or storage. Oxidized oils can produce free radicals, which may contribute to oxidative stress and inflammation in the body. Excessive intake of certain vegetable oils, particularly those high in omega-6 fatty acids, has been associated with a pro-inflammatory state in the body. Chronic inflammation is linked to various health issues, including cardiovascular disease and autoimmune conditions. Choose oils with a favorable fatty acid profile, such as olive oil, rich in monounsaturated fats, or oils high in omega-3 fatty acids. Number 4. Sugary beverages. Consuming sugary beverages, such as sodas and sweetened fruit juices, may have negative effects on arthritis for several reasons. High sugar intake, particularly from added sugars and sweetened beverages, has been associated with increased levels of inflammation in the body. Chronic inflammation is a factor in many types of arthritis, including rheumatoid arthritis and osteoarthritis. High sugar intake is linked to insulin resistance, a condition where the body's cells become less responsive to the effects of insulin. Insulin resistance is associated with inflammation and may contribute to the development or exacerbation of arthritis. Excessive consumption of sugary beverages has been linked to an increased risk of developing conditions such as type 2 diabetes and cardiovascular disease. These conditions can further complicate the management of arthritis. Consuming sugary beverages may contribute to an imbalance in nutrient intake. People who frequently consume these drinks may be less likely to get the essential nutrients their bodies need for optimal joint health. Reducing or eliminating sugary beverages from your diet may have potential benefits for arthritis management. Instead, opt for water, herbal teas, or other low-calorie, hydrating options. Choosing beverages that are rich in antioxidants and anti-inflammatory properties, such as green tea, may be particularly beneficial. Number 5. Processed foods. Processed foods are often high in unhealthy fats, sugars, salt, and other additives, and they can contribute to inflammation and worsen arthritis symptoms for some individuals. Many processed foods contain ingredients that can promote inflammation in the body. For example, certain cooking oils used in processed foods may contain high levels of omega-6 fatty acids, which, when not balanced with omega-3 fatty acids, can contribute to inflammation. Processed foods, especially sweetened snacks and beverages, often contain high levels of added sugars. Excessive sugar consumption may contribute to inflammation and can also lead to weight gain, which can exacerbate arthritis symptoms. Some processed foods, particularly those with partially hydrogenated oils, may contain trans fats. Trans fats are known to promote inflammation and have been linked to various health issues, including cardiovascular problems. Many processed foods contain artificial additives, preservatives, and flavor enhancers. Some individuals may be sensitive to these additives, and their consumption could trigger inflammation or worsen existing symptoms. To support joint health and manage arthritis symptoms, it's generally advisable to focus on a diet rich in whole, unprocessed foods. This includes plenty of fruits, vegetables, lean proteins, whole grains, and healthy fats. Number 6. Processed meats. Consuming processed meat has been associated with certain health concerns, and there is some evidence to suggest a potential link between processed meat consumption and an increased risk of certain inflammatory conditions, including arthritis. Processed meats often contain additives, preservatives, and flavorings that may contribute to inflammation. Additionally, the cooking methods used in processing, such as smoking and curing, can lead to the formation of potentially inflammatory compounds. Certain cooking methods used in processing meat, such as grilling, frying, or roasting at high temperatures, can lead to the formation of advanced glycation end products, AGEs. Some studies suggest that AGEs may play a role in inflammation and the progression of arthritis. Processed meats often contain nitrites and nitrates, which are used as preservatives. These compounds can undergo chemical reactions during processing and cooking, forming substances that may have pro-inflammatory effects. Number 7. Alcohol. Excessive alcohol consumption may be associated with an increased risk of developing inflammatory forms of arthritis, such as rheumatoid arthritis. Gout is a type of arthritis that results from the accumulation of uric acid crystals in the joints. Alcohol, especially beer, has been linked to an increased risk of gout attacks. Certain types of alcohol, like beer, contain purines that can contribute to elevated uric acid levels. Chronic heavy alcohol consumption is associated with decreased bone density and an increased risk of fractures. This can be a concern for individuals with arthritis, especially if they are at risk of osteoporosis. For individuals with arthritis who take pain medications, it's important to be aware of potential interactions between alcohol and certain medications. Alcohol can enhance the sedative effects of medications, and excessive alcohol consumption may exacerbate side effects or increase the risk of complications. Alright, let's talk about the best diet for arthritis. There's no magic cure for arthritis, but a healthy diet can certainly play a crucial role in managing symptoms and promoting joint health. So, what should you include in your arthritis-friendly diet? Anti-inflammatory foods. Focus on foods with anti-inflammatory properties, such as fruits and vegetables, which are rich in antioxidants and phytochemicals. Berries, leafy greens, and brightly colored vegetables are excellent choices. Fatty fish. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and trout, have anti-inflammatory effects. Consider incorporating fish into your diet a few times a week. Nuts and seeds. Walnuts, flax seeds, chia seeds, and other nuts and seeds are good sources of omega-3s. They can be added to salads, yogurt, or smoothies. Whole grains. Opt for whole grains like brown rice, quinoa, and whole wheat over refined grains. Whole grains provide fiber, which is beneficial for gut health and may have anti-inflammatory effects. Lean proteins. Choose lean protein sources, such as poultry, fish, beans, and legumes. Plant-based proteins like tofu and tempeh are also good options. Herbs and spices. Turmeric and ginger have anti-inflammatory properties and may help alleviate arthritis symptoms. Consider incorporating these spices into your cooking. Low-fat dairy or dairy alternatives. Some individuals with arthritis may benefit from reducing dairy consumption. Consider low-fat or non-dairy alternatives like almond or soy milk. Hydration. Staying hydrated is essential for joint health. Water helps keep cartilage soft and hydrated. Limit sugary drinks and excessive caffeine.